we just saw that the new booster is going to be rolling out. Can you talk about the actual schedule for that? Who's eligible? Who should be getting these shots?
Sure. So the CDC today recommended updated COVID vaccines for everyone over the age of 6 months. And reminder that these vaccines protect us from the most serious harms that this virus can still cause. I want to make sure to talk to folks who are over 65. If you are over 65, this virus, unfortunately, is still killing people. About 80% of the deaths from COVID are in people who are over 65. So I really want folks who are over 65 to make a plan right now to get their updated COVID vaccine and, in fact, get your flu shot at the same time.
Any concerns about pricing and such, just because we know that some folks say that they're going and looking into it and realizing maybe they're not getting coverage for these boosters like they were before?
So for the COVID vaccine, everyone should be able to get access to a free vaccine this season, either free because your insurance covers it or because the CDC is running a program that allows the uninsured or the underinsured, so if your insurance doesn't cover it, to get access to a free vaccine. And that program will run at places like CVS, Walgreens, public health departments, federally qualified health centers. You can go to vaccines.gov to find a location for where free vaccines are being administered.
Now, I had heard that a figure quoted of 97% as far as the percentage of Americans at this point who've either had COVID or they have had the shot or they have some sort of protection from COVID. I guess at this point, what is the impetus to go ahead and get this booster?
Yeah, we're in a better place than we've been. So everyone has some level of immunity to this virus, which is great news. They've either had it before, like you said, or they've been vaccinated. However, we know that protection decreases over time, and we know that this virus is changing. So this updated vaccine is both matched to the changes in the virus and allows us to get that extra boost and get us back up in terms of our level of immunity. And remember, for those over 65, where we're seeing most of the deaths, the vaccine can save your life. But remember, for the rest of us, that it can also prevent long COVID. We're seeing more folks get extended symptoms after they've had COVID. So it's not just a simple thing for a lot of folks, but getting vaccinated can help reduce your risk of getting long COVID.
Speaking of symptoms, over the course of the pandemic, we kind of saw the symptoms evolve as far as what the prominent symptoms would be for whatever particular variant we were dealing with at the time. What is that looking like nowadays?
Yeah, so it's similar. So it continues to be similar types of symptoms. So it's a low-grade fever, cough, runny nose, achy body. So those kinds of symptoms. And to be honest, it could look just like you feel if you got flu, which is why if you are feeling sick, it's important to get tested. Find out if it's COVID, is it flu, because you want to get treatment. And unfortunately, treatment also needs to get started right away. So don't wait to get tested. Treatment could also save your life and frankly also reduce your risk of long COVID.
You mentioned the flu, and of course, in the past, we've talked about concerns about triple-demic and RSV and flu and how everything kind of coexists with COVID. What is it looking like for the season as far as the main concerns for respiratory illnesses?
Yes, we're going to see all three of these viruses increase and circulate all at the same time. But the good news is that we have vaccines against all three of those major respiratory viruses that are going to be circulating. So now is the time to get ourselves prepared and protected as we go into that season. Right now, you can get your updated COVID vaccine, you can get your flu shot, and for older adults, you can get protected against RSV. And in just a few weeks, it's going to be available a new immunization for babies to get to protect them against RSV as well. So we have lots of tools, we just need to use them.
Any concerns that some folks might be like, hey, we just did all the precautions for the last, 3 years and I'm tired of this. What is your message to those folks?
Well, I know we all wish we could leave COVID in the rearview mirror, but it's here. And we want to keep protecting ourselves. And look, I wouldn't recommend something that I wouldn't recommend for my own family, right? I'm a mom and a daughter and a wife. And so you'll see my daughters who are 9 and 11, they're going to be get vaccinated. I'm getting vaccinated, my husband, my parents. And it's because I want them to be protected. I want to make sure that they're as protected as they can going into the fall and winter. I want to make sure that we're celebrating holidays together and that sickness doesn't prevent us from seeing each other. So we have the tools, we just need to use them.
Of course, I got to ask this question. Any remarks specifically for North Carolina? I know you have a lot of experience dealing with the health aspects here in COVID, also handling that during your time over at DHHS here.
Right. Well, even though I'm now the CDC director, North Carolina always has my heart, and I care so much about making sure that North Carolinians can be healthy and can be safe. And so I want to make sure everyone goes out and gets vaccinated so they can protect themselves. But remember, there are other tools. There's testing, there's treatment, there's washing your hands, wear a mask if there's lots of virus around, open a window, have things outdoors, right? There's layers of protection. We don't need to go back to any of the things of the past where we couldn't see each other, right? But we do still need to protect ourselves. We don't want to see anyone fall sick when we could have prevented it.
Yeah, I was going to ask, for those folks who are like, oh gosh, here we are talking about the COVID vaccine again, and maybe worrying if we're going to be ever backsliding or revisiting, lockdowns and stuff like that. You feel pretty confident we won't be seeing, widespread sweeping school closures, et cetera, that sort of thing.
Right now, we have all the tools we need to keep this virus at bay, right? If we use the vaccines and we use testing and treatment, but we always have to be humble about this virus. It could change. Something could come out of left field. And I was always clear with North Carolinians that I would come back and say, this is what I know, and this is what I don't know, and we'll come back. So right now, what I see is I don't see any need for mandates or those kinds of things right now. But we have to keep watching this virus, seeing how it changes. And if we need to make other recommendations, we will.
Anything I didn't ask that you'd like to add?
Well, so I just want to remind folks also that this vaccine has been extensively studied. This is one of the most studied vaccines in history. We've given out more than 600 million doses of it. So we're very clear on the fact that it is a safe and effective vaccine. And so I would just want folks to know what good evidence we have to make sure that we know that this vaccine works and it is safe.
And I take it as far as the side effects that we would expect or some of the, I would say, rare instances of reactions, if you will, are similar to what we would have expected from prior boosters or prior versions of this vaccine.
That's right. So we saw very, very rare, more serious side effects. Most people have just some, localized pain on their arm and a little bit of, Advil or Tylenol, and they're good. So, that's why, again, super safe vaccines that we want to make sure folks are taking advantage of to protect themselves.